A woman wakes up from surgery. She remembers her name. She remembers her childhood. But something is missing. She no longer feels love, no fear, no anger. Her husband stands beside her bed, waiting for recognition. She looks at him and feels nothing. What if a single surgery could erase who you are, while keeping you alive? Not kill you, not put you to sleep forever, but quietly remove your personality. Tonight, we uncover the true story of the surgery doctors once celebrated, and families later realized had stolen their loved ones without killing them. This is not science fiction. This is not horror cinema. This really happened. The early 20th century was an age of panic. Mental hospitals were overflowing. Depression, schizophrenia, anxiety, trauma. Conditions doctors barely understood. Patients screamed. Patients refused to eat. Patients harmed themselves and others. There were no antidepressants, no antipsychotics, no modern therapy. Doctors were desperate, and desperation is where dangerous ideas are born. In 1935, a Portuguese neurologist named Antonio Egas Moniz proposed something radical. He believed mental illness lived in the frontal lobes of the brain. His solution: cut the connections. No pills, no talking, just sever the wiring. He called it a leucotomy. The early results shocked the world. Patients became calm, quiet, obedient. Doctors applauded. Families felt relief. Medicine declared victory. In 1949, Moniz received the Nobel Prize in Medicine. The surgery was now officially validated. What could possibly go wrong when the world's highest medical honor approved it? Hospitals rushed to adopt it. And then came the man who would turn it into an assembly line. In the United States, psychiatrist Walter Freeman wanted speed. Operating rooms were slow. Anesthesia was expensive. So Freeman invented something horrifyingly simple. A tool resembling an ice pick. He slid it behind the eye socket and tapped it through the skull with a hammer. No operating room, no surgeon, just minutes. Freeman performed lobotomies in offices, in hotel rooms, sometimes in front of audiences. He called it progress. Patients stopped screaming. They stopped fighting. They stopped feeling. Doctors called it success. Families called it peace. But something was wrong. Formerly vibrant people became silent shells. Mothers stopped loving their children. Artists lost creativity. Workers lost ambition. They were alive, but not present. Rosemary Kennedy was intelligent, kind, and struggled with mood swings. At age 23, her family approved a lobotomy. The surgery failed catastrophically. She lost the ability to speak clearly, to care for herself, to live independently. She spent the rest of her life institutionalized. The Kennedy family never spoke of her again. By the 1950s, evidence mounted. Patients were not cured. They were damaged. Some became childlike. Some became impulsive. Some became permanently disabled. Then came psychiatric medications. And suddenly, lobotomy was no longer necessary. Hospitals quietly stopped performing it. No apology, no accountability, just silence. Modern neuroscience now knows the frontal lobes are the seat of personality, decision-making, empathy, morality. Lobotomy didn't heal illness. It removed the ability to suffer by removing the ability to feel. If pain makes us human, if emotion defines identity, then what happens when medicine decides that quiet matters more than personhood. The lobotomy is gone, but the question remains: how far should science go before it stops seeing patients as people? And how many personalities were erased before the world finally looked away? They survived the surgery, but they never came back.